Welcome to my channel Medicine Guide. Cefdinir is used to treat a wide variety of bacterial infections. This medication is known as a cephalosporin antibiotic. It works by stopping the growth of bacteria. This antibiotic treats only bacterial infections. It will not work for viral infections, such as common cold, flu. Using any antibiotic when it is not needed can cause it to not work for future infections. In this video we will discuss how to use Cefdinir Oral, its dosage and side effects. So let's start our discussion. But before that, please subscribe to my channel Medicine Guide. How to use Cefdinir Oral. Take this medication by mouth with or without food as directed by your doctor, usually once a day or twice a day, every 12 hours. The dosage is based on your medical condition and response to treatment. For the best effect, take this antibiotic at evenly spaced times. To help you remember, take this medication at the same times every day. Continue to use this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Some medications can bind with Cefdinir, preventing its full absorption. If you take antacids containing magnesium or aluminum, iron supplements, or vitamin, mineral products, take them at least 2 hours apart from Cefdinir. Tell your doctor if your condition lasts or gets worse. Cefdinir dosing information. Usual adult dose for pneumonia. Community acquired. 300 mg orally every 12 hours for 10 to 14 days. Usual adult dose for bronchitis. Acute exacerbations of chronic bronchitis. 300 mg orally every 12 hours for 5 to 10 days or 600 mg orally every 24 hours for 10 days. Usual adult dose for sinusitis. Acute maxillary sinusitis. 300 mg orally every 12 hours or 600 mg orally every 24 hours for 10 days. Usual adult dose for skin or soft tissue infection. Uncomplicated. 300 mg orally every 12 hours for 10 days. Usual adult dose for tonsillitis, pharyngitis. 300 mg orally every 12 hours for 5 to 10 days or 600 mg orally every 24 hours for 10 days. Side effects. Diarrhea, headache, or nausea may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. This medication may cause your stools to turn a reddish color, especially if you also take iron products. This is harmless. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including signs of liver disease, such as nausea, vomiting that doesn't stop, loss of appetite, stomach, abdominal pain, yellowing eyes, skin, dark urine, unusual tiredness, new signs of infection, such as sore throat that doesn't go away, fever, easy bruising, bleeding, signs of kidney problems, such as change in the amount of urine, mental, mood changes, such as confusion. This medication may rarely cause a severe intestinal condition due to a bacteria called C. difficile. This condition may occur during treatment or weeks to months after treatment has stopped. Tell your doctor right away if you develop diarrhea that doesn't stop, abdominal or stomach pain, cramping, blood, mucus in your stool. If you have these symptoms, do not use anti-diarrhea or opioid products because they may make symptoms worse. Use of this medication for prolonged or repeated periods may result in oral thrush or a new vaginal yeast infection, oral or vaginal fungal infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge or other new symptoms. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing. That's enough for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer. Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindications or drug interactions. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine God.